Hello and welcome back to my channel FMG to MD. So today's video is going to be about the most frequently asked question, that is how to study medicine for NeetPG. Everyone knows that medicine is a subject of major importance in NeetPG that consists of almost 20 questions every year. So how to study medicine, how to approach medicine, and so-called how to finish medicine. First of all, try to understand what is medicine. Is medicine a subject in itself per se, or is it a combination of multiple subjects? It is a combination of multiple subjects, that is physiology, pathology and pharmacology. Never directly jump into medicine when you are preparing, because always follow a sequence of these subjects at least. First start with physiology. In physiology, you will study how our normal body functions. Then in pathology, you will study what are the diseases, how are they being effective to us, and what are the way that they are causing harm to our body. In pharmacology, you will study about particular classes of drugs, how do they act, their side effects, their indications at all. So what is medicine then? If we have a particular subjects for all of these three, then what is the role of medicine? See, medicine role comes into the clinical practice, because whenever a patient is coming, patient is not coming and saying, Dr. Saab, I have this problem. No, they are coming with symptoms. So you should know what are the clinical features of the diseases. So that's the first role of teaching you medicine. Second is complications, because every disease has a chronic phase and acute phase and complications. So what made that patient came to emergency because of so and so condition, so and so symptoms. So you should know the clinical features and complications of diseases that you will study in medicine. Now coming to the patient has come to you in emergency, what all tests you will run to make a provisional diagnosis, because when a patient comes, you always have differential diagnosis by history and examination. So what all tests, biochemical tests, CBC, some radio imaging, what all tests you will run through to diagnose that particular disease. And the last is not the drugs but the treatment guidelines. Okay, so that is medicine. So never ever jump to medicine directly. Always have a path of studying medicine: physio, patho, pharma, and then medicine. And never ever study medicine from A to Z. Do not touch Harrison for your NeetPG preparation. It's a good book for someone who is having a reference or long exam questions or for that, but do not take Harrison. If as a reference you can use, but do not take Harrison that you will study medicine from Harrison. No. Especially this video is for those students who are preparing from online platform, because see, if you're someone who is preparing from an offline platform, then your teacher are trying to teach to the point, very exam oriented, and their notes are very concise. Whereas on the online platform, they try to provide us as much information as possible. So the onus is on us that we have to put the filter that what is very high yielding, what is not high yielding. So how will you come to know? First of all, I have said multiple times in my previous videos that you should do PYQs and PYTs in the last 1 month. But here I want to make a small change. If you are someone who is doing offline teaching, then you should stick to that. Do PYQ and PYTs in last month only. Do not start from starting. But if you are someone who is studying from the online platforms, then start doing PYTs and PYQs in starting. Because if you will do PYQs and PYQ in starting, then you will know that these are the high yielding areas. These are the high yielding topics. So I should be focusing more upon that. And the topics from which questions are rarely asked, chances are rare only that they will be asked in your exam as well. So if you're someone from online, try to do PYT and PYQ not on a daily basis but on weekends, so that you will come to know that these are topics of high yield. So that's how you will come to know in medicine which is high yielding, which is not. So this is the 4 things that you have to study from your medicine notes, because in medicine notes everything is given: pharmacology, pathology, physiology, but you have to directly jump onto clinical features. But you can only do that when you have made all these 3 subjects of strong basis. If you have just made some shortcut for these 3 subjects, then you'll not be able to understand medicine. So make sure that your basics of these 3 subjects are strong, so that you can directly skip all the topics and then directly come on to the clinical features in medicine. So a lot of time has been saved on your part. Now I'll take an example. Coming to heart failure. Heart failure, we all know that in heart failure there are 4 pillars that we use in heart failure. That is beta blocker, SGLT2 inhibitors, MRAs, mineral receptor corticoid antagonist, and then RNAV. This is what we have been taught in pharmacology. So what's the role of medicine? In medicine, you will study that which drug to be initiated first, which drug to be initiated few days after other, what drug interactions can happen, what are the benefits of these four drugs if we are giving all four together. So what are the guidelines for these four drugs? So that is a role of medicine that helps you in giving you the guidelines. First point. Second, if you are someone who are having a bit of old notes, old videos, do not worry at all. This is the book known as Current Medical Diagnosis and Treatment. We call it as CMDT. This is the book of core medicine. It has only basic pathology, no physiology, and very core clinical medicine. It has the guidelines, how the patient comes, how do we investigate, and the core treatment guidelines. What should we start, what should we not start, after how many days we should augment to the some other dose, to some other drug. So if you're someone who does not have any notes, then you can just refer to this book for all the guidelines and make notes out of this book if you do not have any platform, and if you have studied these four subjects from somewhere and you have strong basics. If you have online class, then you need not have to worry about anything of this sort. But if you are someone who is preparing by themselves through online platform, then try to concise medicine as medicine only. Do not run behind patho, physio, pharma when you're studying medicine, because all that will be asked in a separate part in separate questions. Because in medicine, what they're asking are complications, clinical features, investigation of choice, gold standard, and the treatment guidelines. That is a pure medicine. But that will be only covered when you have strong basics in all these three. So first of all, point number one, try to cover all these three subjects before jumping onto medicine. Second point, in medicine, do not study about physiology, pathology, because you have already read that twice or thrice in all these subjects. So directly jump upon to clinical features, complications, investigations, and treatment guidelines. And if you have time and you really want to learn through the new treatment guidelines, because this book is published every year. We have CMDT of 24, 23, 25. So if you want to refer to the latest guidelines that a new question can be asked from this guidelines as it has been changed, then you can refer to this book. Either you can get a PDF of this from Telegram groups or a hard copies from Amazon. So that was all for today. At last, I would like to say, detach yourself from results and attach yourself towards the work and effort that you put in a work. See, results are not in our hands. We cannot decide what the result is gonna be, whether this thing is meant for us or not meant for us. We do not know. We learn all this when we go through life, because while going, we grow through life. So never attach too much with results, because when you attach yourself too much with results, the chances are, if the results are not in your favor, then you will be really heartbroken. So your thing is, I have given my best. Now results are not in my hand, but I am having no regret or no guilt because I gave my best. First thing. Second, have dreams but do not have expectations. There is a very thin line of difference in expectations and dreams. Dreams are limitless, but dreams inspire us, admire us to become a better person. On the contrary, expectations is like we are demanding something from our surroundings, be it person, be it career, be it job. Both are built in our mind, but expectations are meant to be broken. So do not expect anything from anyone except yourself. गीता का मुख्य मंत्र, कर्म पे ध्यान दो, फल पे नहीं. अगर आपने अपनी पूरी शिद्दत दिखा दी कर्म में, फल आपका होगा ही, कोई सेकंड थॉट ही नहीं है. लेकिन अगर आपने अपने आप को फल से जोड़ लिया, देन आपका ध्यान कर्म में नहीं लगेगा, एंड देन यू विल बी अ लॉस्ट वॉन्डरर. आई विश यू ऑल द बेस्ट फॉर द एग्जाम्स. गुड लक एंड टेक केयर.